everyone, my name is Victory and I'm a lecturer in adult nursing. I'm the face behind the nurse's brain, and the entire concept behind the nurse's brain is to simplify nursing practice, nursing knowledge and nursing skill. Why do we need to simplify it? Sometimes as student nurses or even as young colleagues, newly qualified nurses, it can be very difficult to understand the entire knowledge and skills behind nursing practice. There's a lot of concepts to learn. We're talking about pharmacology and we're talking about pathophysiology, we're talking about anatomy and physiology, and obviously all of the laws and ethics that come on with your nursing practice as well as your nursing process. There's so many information out there, and I found that sometimes the problem it's not the lack of information, it's the complexity of the information. So that brings us to the rationale for this channel, which is basically to speak in a simplistic form so you're able to understand nursing knowledge, nursing skills through everyday language. So seeing things as easy as a very simple example to make you to start thinking about how you can connect the knowledge of your anatomy, your physiology, your pathophysiology, your pharmacology, and obviously your nursing process and your nursing care. So that's the purpose of this channel, and that's what we're going to be doing, trying to speak regular English language when it comes to nursing practice, nursing knowledge, and nursing skills. In general, we're going to start with the concept of anatomy and physiology, which is basically how the body, the study of the structure and then the function of the body. And then we're going to link this into things like pathology and pathophysiology, and then draw in your nursing process, your pharmacology into the process, making it super easy for you to understand. Now, I've had so many nurses questioning the fact that they do need to learn anatomy and physiology. Why do they need to learn anatomy and physiology? Simple. You do need to understand the concept of your anatomy and physiology because it aids the kind of personalized and individualized care you give to patient. Say, for example, we've got our abdominal cavity, and then we've got the quadrant of our abdominal cavity. If you are unaware of the location or the quadrant of the anatomy of the abdominal cavity, it then means when a patient is having a severe pain at certain quadrant, you're unable to give your differential diagnosis, assess the patient properly, and unable to figure out what's wrong with them. So it's a very key component of your nursing journey for you to be able to understand your anatomy and physiology. And then because this help you to understand things when they are broken, which is your pathology or pathophysiology, and this would then aim and direct your care you give to your patient, inclusive of your assessment, your implementation as well. So let's take a simple iPhone, for example. For iPhone users, I'm not an iPhone user. What's one key feature that fascinates me when it comes to iPhone using is the fact that it's FaceTime. So you could literally just call someone over a video call. Now, what's the concept of this iPhone? What's the structure of this iPhone that makes it work this way? The structure is the camera, and then obviously the software by Apple. And then what's the function? FaceTime. Structure, function. How do we understand when FaceTime doesn't work as it should, when it's broken? It's only if we understand the normal structure and function of this iPhone. Then we'll be able to identify when something is now problematic, pathology, and we can trace what's normal to what's abnormal, the causative factors, the symptoms we're seeing now, pathophysiology, and that would aid us signposting the kind of care we can give to this patient. Say it be our nursing assessment and nursing diagnosis, implementation and evaluation. And then this draws into the knowledge of pharmacology, because then if we have the knowledge of the right medication for the right condition, and then the pharmacokinetics and pharmacodynamics, which is basically what our body does to the drug and what the drug does to our body, then we'll be able to understand how to use it effectively. So this is just a little bit of an introduction of what we're going to be doing in this channel. And please, if you do know any other nursing student out there or any newly qualified nurses who are struggling to understand the concept of nursing skill and knowledge and bringing all of this concept into reality, do share this channel and look out for what's next. See you until next time.
Learning anatomy can feel like deciphering an alien language. Muscle names, anyone? And then there's physiology. It's like trying to solve a puzzle with missing pieces. Pathology? More like a drama series with plot twists that keep you guessing. Pharmacology can feel like an endless menu at a gourmet restaurant. So many choices. But wait, here's where the nursing brain comes in. It solves these challenges like a superhero. With the nursing process and evidence-based practice, we become the heroes of healthcare. If you enjoyed this journey through the nursing world, don't forget to subscribe, like, and share. Ending with a fun music beat as our superhero nurses save the day.